Assalamualaikum and hello everyone. My name is Nur Arni binti Kamsani. So today I'm going to talk about what is Wolf-Hirschhorn syndrome. Welcome to a closer look at Wolf-Hirschhorn syndrome, also known as a chromosome 4p syndrome, a rare congenital disorder affecting approximately 1 in 50,000 births in the United States, though likely underdiagnosed. This condition occurring twice as often in females compared to males, which is not typically inherited disorder. It's a result of microdeletion in the critical region of chromosome 4, marking as the first disorder linked to a missing chromosome piece. The impact of Wolf-Hirschhorn syndrome on affected individuals is profound, with a heightened mortality risk in the first 2 years of life. Causes range from lower respiratory tract infection to congenital anomalies, sudden unexplained death, and also congenital heart disease. Compounding this challenge, these children often face immunodeficiency issues, including IgA and also Ig2 subclass deficiencies alongside normal T-cell immunity. One key identifier is the distinctive facial appearance, often described as the Greek warrior helmet look. This unique feature triggers initial clinical suspicion at birth. To confirm the diagnosis, molecular tests for chromosomal defect are conducted, providing a clear picture of the genetic landscape. Despite its rarity, Wolf-Hirschhorn syndrome underscores the importance to early detection and comprehensive care for affected individuals and their family. By shedding light on this condition, we move closer to understanding and supporting those living with a chromosome 4p syndromes. Let's stand together to raise awareness and foster a more inclusive understanding of Wolf-Hirschhorn syndrome.
Hi, my name is Nordama Iwani and I will present to you the major symptoms of Wolf-Hirschhorn syndrome. There are 4 major symptoms for this disease. The first one is distinctive facial features or appearance. The patient facial features will have small head, broad muscle bridge, large and protruding eyes, high forehead, short philtrum, downturned mouth, small chin, and skin changes. While the patient appearance will have skeletal abnormalities such as scoliosis and kyphosis, dental problems such as missing teeth, cleft palate and lip, abnormalities eyes, ears and heart. Secondly, delayed growth and development. The patient will have feeding problems, weak muscle tone, poor movement, delayed motor skills in standing and walking, and short stature because the poor ability to absorb nutrients. The third one, intellectual disability. The patient might have strong social skills, but they have weak verbal communication. That causes the need to use speaking device and sign language. Lastly, the fourth one, seizures, which are most affected are children, but it can disappear with age. That's all from me. Thank you.
Hi, my name is Nur Shafika, and now I will talk about the genetic causes of this disease. Basically, it happens when part of short arm of chromosome 4 at the band 16.3 is deleted. Each chromosome has a short arm designated as P and a long arm designated as Q. Chromosomes are further divided into numbered bands. For example, chromosome 4p16.3 that refers to the band 16.3 on the short arm of chromosome 4. This deletion has causes some of important genetics on the chromosome are being removed. The deletion of NSD2 gene can cause distinctive facial appearance and developmental delay, while deletion of LETM1 gene can cause seizures or abnormal electrical activity in brain. Deletion of MSX1 also can cause dental abnormalities and cleft lip of palate. The amount of chromosome that is missing is different for each person. If the child is missing a large part of chromosome 4, they will have more severe symptoms. This disease actually cannot be inherited from parents as the deletion occurs spontaneously, or we call as de novo, during egg or sperm development or early embryonic development. But there are a few cases where this disease is inherited from a parent who has a balanced translocation. A balanced translocation means 2 or more of their chromosome broke and switched spots during their development. It usually doesn't cause any symptoms in that parent since the chromosomes are still balanced, but it can be transmitted to a child in an unbalanced form, leading to missing or extra genetic material of the chromosome. About 87% of cases represent a de novo deletion, while about 13% are inherited from a parent with a chromosome translocation.
Assalamualaikum. My name is Norain Farhana and I will be talking about diagnosis of Wolf-Hirschhorn syndrome. There are two ways to diagnose if your child has this syndrome or not. First is chromosome microarray. Chromosome microarray is a genetic test that detects chromosomal abnormalities in your kid by analyzing a little sample of their blood, saliva, or cheek cell. This sample will be used by your provider to confirm the diagnosis. Your provider will analyze your child's DNA after receiving sample from them. If the test reveals that certain segment chromosome 4 is absent, your child will be diagnosed with Wolf-Hirschhorn syndrome. Second diagnosis is during early childhood, which is facial characteristics, growth problems, development delay, and seizures.
Next, I'm going to explain about how the disease is treated. There is no cure for Wolf-Hirschhorn syndrome. Treatment primarily focuses on managing the symptoms and providing supportive care to improve the individual's quality of life. Here are some general aspects of management for individuals with Wolf-Hirschhorn syndrome. Firstly, early intervention service. Early intervention programs aim to address developmental delays and provide support in areas such as speech therapy, physical therapy, and occupational therapy. Secondly, medical management. Individuals with this syndrome may require medical management to address specific health issues associated with the syndrome. This may include treatment for seizures if present, monitoring and managing heart defects, and addressing any other medical concerns identified by healthcare professionals. Next, educational support. Children with Wolf-Hirschhorn syndrome often benefit from special education services tailored to their individual needs. These services may include adaptive learning techniques, modified curriculum, and other resources to support their educational development. In addition is genetic counseling. Genetic counseling can be very valuable for families affected by the Wolf-Hirschhorn syndrome. Genetic counselors can help families make informed decisions about family planning and understand the implications of the syndrome better. Lastly, multidisciplinary care. This multidisciplinary approach helps address the diverse needs of individuals with Wolf-Hirschhorn syndrome.